Hi guys, it's Mrs. Bartels. We are going to finish up chapter 23 today. So I'm going on over to the PowerPoints. It is Wednesday. We are doing the last set of the PowerPoints for chapter 23. Okay, so we are going down to starting on slide number 29. Okay, so I'm going to go over to slideshow. Slide number 29 starts with the dining programs, which are on page 341. Facilities, nursing homes, assisted living settings have certain dining programs that they follow. You need to know what dining program your facility follows. I know when we go out to Windscape for our clinicals that they follow social dining, low stimulation dining, and restaurant style menus, the ones that are listed there. So we're going to talk about those. We'll talk about all of them. So the dining programs are common in nursing centers. We have social dining, which means it's like 4 to 6 residents are sitting at one table together. They're able to feed themselves. They're able to socialize with each other. Kind of like when you go to a restaurant, you sit with your family. Family dining is where we have large portions of food put out on a table and everybody helps themselves to it. Like you have a platter with beef on it, you have a bowl of mashed potatoes, and you pass the stuff and help yourself to whatever you want. Don't see that very often in nursing homes or assisted livings. Okay. Low stimulation dining is for people who have a hard time with loud noises or being around other people. Sometimes people with dementia is a good example of this, or mental health issues. They just don't do good. They might rock, they might scream, they might not eat appropriately. So what happens with them is if they are overly stimulated, too much is going on around them, they act out. So with those people, they're usually sat with certain residents, or they might be sat in a different area so their distractions are prevented and they don't act out. Okay. Restaurant style menus is what Windscape uses. So when you bring your patient down to the dining room, you go to the window and you say, I have Mrs. Smith with me. And after you have her all situated at her table, you go out to the window and you're like, I need Mrs. Smith's dietary card, please. And it's like a little menu. And you go back to her and you tell her, okay, can you fill this out? You give her a pencil. She picks out what she wants. If she cannot read or see it or do the pencil writing, you do it for her. You tell her, okay, so your choices are baked chicken or baked roast beef. Okay. Gravy, rice, mashed potatoes, you have them pick what they want. Okay. And then you take that back to them to the dietary window and say, this is what she wants. And they prepare her tray, just like they order like in a restaurant. And then open dining is buffet style. We do not see that very often in a nursing homes. You will see, like I said, Windscape does the restaurant style where you get a little menu and they circle what they want. They try to sit people to socialize. And then they do have low stimulation dining that's towards the back of the dining room. Those are people who might need more one-to-one supervision or need to be in smaller settings. Those are also where the feeders go. Okay, the people that need to be fed. Preparing for meals. So we have to get somebody ready to go down to the dining room or to eat, even if they're eating in their kitchen or if they're eating in their bedrooms or in their patient rooms, they still have to be prepared. Okay, so you still have to get them ready, because if they are not ready and they might have the following things going on, their appetite and the ability to eat may be affected. If they're weak, if they're ill, if they're confused, they might not understand what it is to eat anymore. If there's unpleasant odors or sights or sounds, they might not want to eat. Okay, so if you have one patient, if you have 4 people sitting at a table, one patient is incontinence and his aide didn't clean him before he brought him down to the dining room, he's sitting next to the other person, that person smells. Okay. If you bring somebody down in the dining room and their hair is all messed up and they got like their breath is, still down their shirt, who wants to sit next to the messy person? So you have to make sure that the people look appropriately and they smell appropriately. Just like if you want them to look like if they're going into a restaurant. Okay. You want them to look presentable. It's called dignified care. If a person's uncomfortable, they're not comfortable in the position that they're sitting in, they don't like the chair they're sitting in, or they're in pain, they're not going to want to eat. If their mouth has not been cleaned, the food's not going to taste right. So make sure you do oral hygiene. If they need to go to the bathroom, they're probably not going to want to sit at a table and eat because they need to pee or they need to go to have bowel movements. Okay, so the last thing they want to do is eat. Or if they're incontinent and you didn't clean them, they're sitting in stool and urine, the skin is going to be irritated. They're not going to want to sit there. Okay, so make sure you take care of those things. Make sure the person washes their hands before eating. You should have hand sanitizer and offer it to your patients when you give them their trays. And you should wash their hands before you bring them down to the dining room. Okay, so these are all things that state looks for when they're doing surveys, just so you guys know. Serving food. Food is prepared to meet each person's needs. Other foods are offered if the person doesn't like what they get. So if they don't like what they get, they can't say, oh, well, don't eat. You just don't eat today. You have to offer them something else. So if they don't like roast beef, you have to get a different type of protein for them. Go back to the kitchen and be like, do you have a ham sandwich? Do you have a turkey sandwich? Do you have chicken? Do you have something else we can give this patient? Okay, so you have to have similar nutritional value, meaning like they cannot just get 4 cups of ice cream today. It has to be a substitute for what they're not eating. When you serve a meal, make sure you know if the patient has any food allergies, what adaptive equipment is needed. We talked about adaptive equipment earlier in the chapter. It's on page 336. Special utensils, special cups, special plates. You have to make sure that all that is available for the patient if they need it, if it's on their care plan. Help them open up their cartons, help them cut their food, help them season and butter their food. If they are an intake, which we'll talk about in chapter 24, you have to keep track of how much fluid they're taking in. If they're on calorie counts, you have to make sure that you know how much of each item on their tray they ate, the percentage of it. So the nurse can diagnose the calories. Okay. Serving meals. You serve meals after the person's prepared for a meal. So once they're up in the tray, up in the dining room and they're clean and they're ready to go, then you go and get the meals. Okay. You have to serve it within 15 minutes. If the food is not served within 15 minutes, you have to check for temperature. If the temperature is not correct, follow the agency policy. Most agencies do not allow you to microwave food, but you need to know what to do. Most likely, you'll have to get a new tray for your patient.
Stick your finger in it.
Check the person's position when serving the meal. Their position may have changed. So before you put the tray in front of them, make sure they're still sitting upright and they're still comfortable. Feeding. Feeding the person is on page 343. Okay. If you're feeding a person, there's certain things that have to be done. You serve the food and fluids in the order the person prefers. So you tell them what's on their tray and they get to pick what they start with. So if they want to start with their brownie, you let them start with their brownie. You offer fluid throughout the meal. So keep increasing their fluids, asking them to drink, because this is probably the only time they will be having fluids. You cannot feed with a spoon or with a fork or a knife. It has to be with a spoon, so you can only feed them with spoons. You can cut their food with a knife, but you cannot have the knife while feeding them. You have to use a teaspoon. If somebody's visually impaired or is blind, you can use the face of a clock to describe where their food is. Just because they're blind does not mean that they need to be fed. Most people that are blind are orientated to how a plate is set up like a clock. If you look on page 343 of your book, you'll see what I'm talking about. There's a plate with the face of a clock around it, and at 6 o'clock is where the person's meat is. At 12 o'clock, their potatoes. 3 o'clock, their vegetables, and that's what you tell them. You'll be like, Mr. Smith, here's your tray. It's in front of you. At 3 o'clock is your vegetables. At 6 o'clock is your meat. At 9 o'clock is your potato. So you basically tell them where it is, and they should be able to feed themselves. You could also tell them what's on it, because obviously they can't see. Describe the food to them. Allow time and privacy for a person to pray. You don't have to pray with them, but if they want to pray, you have to let them pray before feeding them. Engage the person in pleasant conversation as you're feeding them. Sit next to them. Sit at eye level with them. Face them. Okay. Make sure you're watching them. Make sure you're watching that they're swallowing and that they are chewing appropriately. Sitting down shows that you have time for them. It shows that you respect them. It shows that you're not in a hurry. And make sure you always check the diet against the dietary card. Okay, that is all on page 343 of your book. It's also on page 344 underneath the procedure box, numbers 5 through 11. Okay. Between meal snacks is the next thing, page 345. Between meal snacks are snacks that are given usually they're usually between lunch and dinner, or they might be a bedtime snack. The thing with snacks is when they arrive on the unit, you have to serve them, just like trays. You can't let them sit around because if they're supposed to be served hot, they need to be hot. If they're supposed to be served cold, they have to be cold. Make sure when you serve them when they arrive on the unit with the appropriate utensil, like a spoon for ice cream, a fork for cake, a straw if it's a milk. So make sure, and then make sure they have a napkin. Okay, so those are in between snacks. All right, now we're going to talk about assisting with special needs. Some people cannot eat, and we have to somehow get their nutrients in them in other ways. It might be maybe they were had the flu and they were throwing up and they had really bad diarrhea, so we could do IV therapy for them, which is just short term, a couple of days. If they're not eating after a couple of days, we have to then start in the feeding tubes, the internal feeding or internal support. So if it's going to be a long-term issue, they need to get a feeding tube in them. If you're taking care of somebody who has any of these special needs, like an IV for feeding or a G tube or a feeding tube in place, make sure you speak with the nurse and make sure you review the tasks so you understand how to take care of this person. Enteral nutrition is giving nutrients for the GI tract through a feeding tube. Okay, there's two ways that we do it. We can do it for the nasogastric tube or the gastrostomy tube. The nasogastric tube a nurse can put in. We insert it through the nose, down the back of the throat, into the stomach. The gastrostomy tube needs to be inserted in surgery by a surgeon, and it goes through the abdominal wall into the stomach. So here's a picture of a nasogastric tube. Again, a nurse can start at the bedside. We go through the nose, down the back of the throat, into the stomach. And then here's a picture of a PEG tube or gastrostomy tube, which is put in surgery. It goes through the skin into the stomach, is surgically implanted. Okay. Feeding tubes. If people have a feeding tube, that means they can't eat or drink. They are NPO. Don't give them anything to eat or drink. But if you think about it, if you can't eat or drink, you're going to have dry mouth, you have dry lips, you're going to have a sore throat. So a lot of times these people complain of that. You need to do oral care and lubrication and mouth rinses every 2 hours on them, because it's just like an unconscious person. They're not able to eat or drink. So they're at risk of having mouth sores, bad breath, and buildup of like decay in their mouth if you don't do good oral hygiene in them. And you also, if they have an NG tube, you need to clean around the nose and the nostrils every 4 to 8 hours. The NG tube, because it goes in, the tube is about the size of a pencil, the width of a pencil, so it can irritate the nostril. So NG tubes can irritate and cause pressure on the nose and the nostrils. They can change the nostril shape or cause pressure injuries. It has to be secured. The tube has to be secured to the nose using tape. The nurse secures it. If you notice that it's moving up or down or it's loose, get the nurse and she will re-secure it and replace it if it needs to be replaced. The tube should be taped to their nose and also clipped to their clothing. Okay. Things to report if your patient is on a feeding tube. Okay. So observations you need to report. If your patient has a feeding tube, they should not have any stomach issues. They shouldn't be complaining of any stomach problems like nausea, vomiting, diarrhea, stomach pain. That's not right. They have a tube in their stomach. They shouldn't be complaining that. So if they have nausea, if they have pain when they're getting the feeding, if they complain of vomiting, if they have diarrhea, if they complain of a lot of gas, flatulence it's called, okay? If their stomach is distended, meaning it's very large, it looks like there might be a basketball inside their stomach, that's not normal. If their stomach is firm to touch and it hurts to touch their stomach, let the nurse know. If they are coughing, if they complain of heartburn or indigestion. And the other thing that you want to check for too is if you notice a fever or if the person has any redness, swelling, drainage, or odor around the tube that was inserted by the surgeon, because it's a surgical site. So if you notice signs of infection like redness, swelling, drainage, or odor, you need to let the nurse know. Okay. Aspiration is a huge risk for people with tube feedings. So you want to make sure that you do everything you can to prevent aspiration. It's the nurse's job and your job to prevent it. It can cause pneumonia and death. If somebody aspirates, they can get pneumonia and they can die. When the tube is put in place, before the tube is even used or anything is inserted for the tube, we verify the placement with an x-ray. Okay. If a person coughs, sneezes, or vomits profusely, the tube can easily move out of place. So we have to get another x-ray to verify that it's still in place. Anytime that we are going to use the tube and put something into it, the nurse verifies placements. You cannot verify placements because you're not trained to do that. But before I give a feeding, I have to make sure that the tube is in place. And I do that using a stethoscope and a 60 cc syringe. And we listen for the vowel sounds and the swish, it's called. You guys will learn it when you become nurses. To assist the nurse in preventing regurgitation or aspiration, you make sure the patient's kept in Fowlers or semi-Fowlers during the feeding. If it's a continuous feeding, they need to stay in Fowlers. Their head of the bed always has to be up. If it's just a feeding that's going to go over 2 hours, like from 9 a.m. to 11 a.m., the patient needs to be in an upright position during the feeding and 1 to 2 hours afterwards. If it's continuous, meaning they're getting the feeding all day, the person has to have the head of the bed in Fowlers or semi-Fowlers all day. If you're going to have to put the person flat to maybe change them or clean them or give them a bath, the nurse has to shut the feeding off. Nobody can lay flat with a feeding tube running. Okay. So make sure you keep them in 1 to 2 hours after a feeding, or if it's, like I said, continuously, they have to be in upright position, and never lay them on the left side. If they have to be turned, because you do have to turn them to the right side. The left side is not good for the bowel to empty out, and it can cause problems with the intestines. That is the end of the chapter for you guys.